What does a rehab physician do? I take care of function. So it doesn't matter how the person has lost their function, whether it be because of a sports injury, or they had a heart attack, or they had a stroke, or a gunshot wound to the spinal cord, now they're paralyzed. All those patients have lost function, and I try and restore their function the best I can with using medicine, therapy, and intervention.
Physiatrist Dr. Atul Patel at Kansas City Bone and Joint Clinic specializes in function restoration. The only non-surgical specialist with the private practice physician group, Dr. Patel uses cutting-edge technology to assess patients' function.
So when I'm assessing their function, I use different equipment. For example, I assess their nerves and muscles using electrodiagnostic medicine. I assess their muscle and joint function using ultrasound. It's important that sometimes, when we have patients with a problem like carpal tunnel syndrome, oftentimes one of the treatments for that is just to go ahead and do a steroid injection into the wrist. And it's a very low risk procedure and people do fine. Now with newer technology with ultrasound, I can actually see the median nerve and inject right next to the nerve and make sure I don't hit the needle on the nerve, but at the same time I don't nick a blood vessel or something like that.
A former educator, Dr. Patel continues to publish articles while practicing at Kansas City Bone and Joint Clinic.
When I look at the wrist, you could see these circular structures. Some of those are blood vessels.
Restoring function and helping people get back to doing everything they love.
People may have mild deficits in their function, or they might be hurting and not be able to do it properly, but they can maybe still get it done. Trying to improve their function and then actually making a difference in there is extremely gratifying.
For more information on rehab medicine or to schedule an appointment with Physiatrist Dr. Atul Patel, call 913-381-5225 or visit kcbj.com.